Hello, I'm Mr. Kwan Sim, consultant ophthalmologist, working at the Buckinghamshire Healthcare Trust, specializing in treatment of retinal diseases. I've been doing this for the last 12 years. I'm going to talk to you today about the treatment available for age-related macular degeneration, or AMD. It is a common eye disorders among people over the age of 50s. It causes blur or reduced central vision. The common form is the dry AMD, which is general wear and tear with gradual thinning of the central part of the vision called the macula. Unfortunately, there's no effective treatment for the dry macular degeneration. In about 10% of patients with dry AMD, patients develop wet AMD with sudden worsening of vision due to abnormal blood vessels in the macula, which leaks out fluid and bleeds. Thankfully, these complications of AMD, called wet AMD, can be treated. So what treatments are available for wet AMD? Wet AMD can be treated if caught early. At present, the most effective treatment is in the form of injections of anti-VEGF agents in the eye. Licensed anti-VEGF injections include Lucentis or ranibizumab, and Eylea or aflibercept, and brolucizumab or Bevo. These drugs block the action of a molecule, vascular endothelial growth factor or VEGF, in the eye. VEGF makes blood vessels leaky and so causes waterlogging of the macula and reduce the vision. Lucentis and Eylea are licensed for use in wet AMD and have been extensively studied in research clinical trials. There is no evidence that one drug produces better vision than the other. The effect of this injection treatment is only temporary, so they must be given repeatedly, potentially for several years. Patients receive 3 injections, 1 injection every month as an automatic loading course. Patient will have an eye scan and vision test every visit, and this information is used to decide the spacing between further injections after the loading dose. These injections are given over a prolonged period depending on how well the eye responds. Bevo is a new anti-VEGF drug recently approved by National Institute for Clinical Excellence, NICE, for treatment of wet AMD. Current evidence suggests that Bevo may last for longer than the other anti-VEGF drug. We do not always treat wet AMD, however. In patients with excellent vision and early wet AMD, the risk of treatment might outweigh the benefit. Current NHS NICE guidance is that patients with very good vision should be monitored initially and only treated if vision starts to deteriorate in view of the small risk involved with the treatment. So, are there any benefits for treating patients with very poor vision due to advanced wet AMD? Unfortunately, there is no research evidence that injection treatment will work once vision drops below a certain level. At this stage, the disease has advanced too far because the scar tissue has irreversibly damaged the retina. To proceed with treatment in this situation would to put the eye at a risk of total loss of vision with no benefit. Such patient will in all probability remain stable. This disease will never reduce peripheral vision, and so there is no risk that the eye will deteriorate to complete blindness. There are other practical measures which can help each individual to make the best use of their remaining vision should the disease progress to such an advanced stage. The low vision clinic is able to assess each patient individually and recommend the most useful visual aids. Other treatments for wet AMD. Well, there's also another drug called Avastin, also known as bevacizumab. It's an anti-VEGF agent that has been shown to have effects similar to Lucentis and Eylea, but it is not licensed for use in the eye. We occasionally use Avastin if patient's vision lies outside the NICE guidance in some patients. So, how will the treatment help in wet AMD? Anti-VEGF injection has the following potential benefits. There's 90 to 95% chance of avoiding severe visual loss of central vision in the eye treated. 70% chance of keeping the vision as it was at the beginning of the treatment, and a small improvement in vision. In 30 to 40% of patients, there's a big chance of improvement in vision, meaning regaining a large amount of vision that has been lost. So, are there any complication or risks with injection treatment? Like all medicines, anti-VEGF treatments can cause side effects, although not everybody will have this. The side effects are either from the medicine itself or from the injection procedure. Most of the side effects involve the eye alone. Common side effects include discomfort during and after the injection, bruising of the white of the eye, an increase in eye pressure, or moving black spots in the vision called floaters. The less common side effects include inflammation in the eye, bleeding, infection, retinal tear, detached retina, and cataract. Regardless of the drug used, each injection procedure carries a small risk, about 1 in 1,000 chance of serious complication, including infection inside the eye, called endophthalmitis, which can potentially result in total loss of vision if not treated promptly. There are no proven risks to your general health with this course of injection. There is a theoretical risk of blood clotting, like strokes or heart attack, with anti-VEGF drugs, though this has not been proven after many years of experience in using these drugs in large number of patients throughout the world. All of these side effects may occur with the available medicines. Inflammation and immune response appears to be more common, however, with the new Bevo or brolucizumab than with the other medicines. Around 1 in 100 patients treated with brolucizumab or Bevo will experience permanent loss of vision due to inflammation over the course of the treatment. This has to be weighed against the potential benefit, however, that this drug tends to work longer, last longer, with potential better visual outcome. Thank you.